Welcome back to Health is Wealth, your trusted source for health, wellness and insights. Today we're diving into the world of medicinal plants and herbs for diabetes, how they work, what the evidence shows, and most importantly, how to use them safely alongside your conventional therapies. Remember, this content is informational purposes only. Always consult your healthcare provider before adding any herbal remedy. What is diabetes? Diabetes develops when the body cannot properly use the energy provided by food. When someone without diabetes eats, the body breaks down the food into a type of sugar called glucose. The sugar then enters the blood and causes blood sugar levels to rise. When this happens, the pancreas releases the necessary amount of insulin, which allows the sugar to enter the body's cells at the appropriate levels. The level of sugar in the blood then falls to normal levels and the body cells use the sugar as fuel. However, when someone has diabetes, this cycle does not work because either not enough insulin is released or the insulin does not work properly to allow sugar to enter the body's cells. Because the sugar has built up in the bloodstream instead of being used by body cells, the blood sugar levels do not fall. Body cells now lack enough sugar to use as fuel because the sugar stays in the bloodstream. Why herbs matter in diabetes health? In ancient history and cultures, people have used plants and herbs to manage and cure diseases. Modern research is catching up and investigating how certain botanicals may help improve insulin sensitivity, reduce post-meal glucose spikes, and support metabolic health. The key takeaway: always seek professional guidance before using these herbs. Herb number 1. American ginseng, Panax quinquefolium. Research suggests that this herb may help lower blood glucose levels by enhancing insulin secretion and improving post-meal glucose responses. One study found that people with type 2 diabetes who took American ginseng before or with a meal had a moderate reduction in glucose levels after the meal. Herb number 2. Bay leaf, Laurus nobilis. Next up, bay leaf. Some studies indicate that using bay leaf, around 500 milligrams, helps the body use insulin more efficiently. Other spices like cinnamon, cloves, turmeric, coriander and cumin may also help with blood sugar. Herb number 3. Berberine. One of the more studied herbal compounds is berberine, a plant alkaloid found in several herbs. It has been shown to regulate glucose and lipid metabolism in both animal and human studies. In fact, some research suggests at doses around 500 milligrams 2-3 times daily it can control blood sugar and lipid metabolism comparably to the diabetes drug metformin. However, the evidence is not definitive, and berberine can interact with many medications, including diabetes drugs, and may cause hypoglycemia. Herb number 4. Bitter gourd, bitter melon, Momerdica charantia. Bitter gourd, also called bitter melon, has drawn substantial interest for its ability to regulate blood sugar. Traditional medicine uses it widely. Emerging research supports its potential role in glucose control, though dosage, preparation and safety vary considerably. Herb number 5. Cayenne, chili pepper, Capsicum frutescens. Cayenne pepper is not just for spice, it's been used in alleviating neuropathic pain in diabetes, for example, in topical cream form. While its role in lowering blood sugar is less direct, its use for diabetic neuropathy is notable. Herb number 6. Cinnamon. Cinnamon is a familiar spice, but research shows it may increase insulin sensitivity and reduce blood glucose and cholesterol levels in people with type 2 diabetes. Because whole cinnamon includes fat-soluble components such as coumarin, which may be toxic at high doses, only the water-soluble extract with patented names such as sinulin PF or sinsulin should be used. Additional studies funded by Diabetes Action found this same cinnamon extract has shown neuroprotective effects on the brain, which can lead to improved prevention and treatment of Alzheimer's disease. Many researchers are now calling Alzheimer's type 3 diabetes. Herb number 7. Curcumin, from turmeric root. Curcumin, the active compound in turmeric, is traditionally used for pain and wound healing, but modern research suggests it may regulate inflammatory cytokines, improve insulin sensitivity and even assist in reversal of type 2 diabetes in some contexts. Some preclinical work indicates curcumin could be much more powerful than metformin in improving insulin sensitivity. Herb number 8. Evening primrose oil, gamma-linolenic acid or GLA. In diabetes, defective fatty acid metabolism can lead to impaired nerve function and peripheral neuropathy. Evening primrose oil rich in gamma-linolenic acid has shown initial promise in improving blood flow and nerve function in these contexts. Herb number 9. Fenugreek, Trigonella phonem graecum. Fenugreek seeds have been shown to regulate blood sugar levels and increase HDL, good cholesterol, while lowering total cholesterol. They're also a good source of soluble fiber, which helps slow carbohydrate absorption. Herb number 10. Flax, Linum usitatissimum. Flaxseed is rich in soluble fiber and omega-3 fatty acids alpha-linolenic acid. Research has shown significant improvement in glucose values with flax fiber intake. Ground flaxseed or its oil can easily be incorporated into muffins, breads or smoothies. Herb number 11. Ginger Zingiber officinale. Ginger is more commonly known as a flavoring or digestive aid. It is one of the most widely consumed spices in the worldwide. It has a long history of use as herbal medicine to treat a variety of diseases including nausea and vomiting, constipation, indigestion, pain, and cold-induced syndromes. A meta-analysis study shows that oral administration of ginger powder for 12 weeks at dose of 2 grams per day caused significant reduction in the level of fingerstick blood glucose. Herb number 12. Ginkgo biloba, Ginkgo biloba. For patients with type 2 diabetes who are poorly managed on metformin, the addition of a ginkgo biloba extract has been shown in some trials to improve treatment outcomes, especially cognitive and vascular components. Herb number 13. Gymnema, Gymnema sylvestra. Gymnema sylvestra, often called sugar destroyer, in Ayurvedic medicine has been shown in trials to reduce HbA1c levels when used as a leaf extract, for example, a 400 mg commercial supplement in a 2000 study. Herb number 14. Banaba, Lagerstremia speciosa. Banaba, also called crepe myrtle, queen's flower or pride of India, has shown evidence of regulating blood glucose levels by increasing insulin action. Herb number 15. Nopal, prickly pear cactus, Opuntia ficus indica. Nopal, the prickly pear cactus common in Latin America, has been studied for its role in controlling and lowering blood sugar, high cholesterol, obesity, and hangovers. It's also known for its antiviral and anti-inflammatory properties. An Austrian study found that Opuntia decreased blood lipids, blood glucose and increased insulin sensitivity. Herb number 16. Onions and garlic, Allium cepa and Allium sativum. Onions and garlic have been used in Asia, Europe and the Middle East to reduce blood sugar levels. The sulfur compounds, e.g., allicin, allyl-propyl disulfide, are believed to mimic insulin-like activity and help reduce blood sugar. Herb number 17. Pomegranate, Pomegranate. Pomegranate contains powerful polyphenols with antioxidant, antiviral and anti-tumor properties. In people with diabetes, research is exploring its role in lowering lipid levels and improving blood flow to the heart. Herb number 18. Pycnogenol, pine bark extract. The pine bark extract known as pycnogenol has been used in some countries to treat diabetic retinopathy and ulcers. A German study showed positive effects on lowering glucose levels. Herb number 19. Red yeast rice. Red yeast rice contains compounds similar to the prescription drug lovastatin, so while it may offer anti-inflammatory and lipid-lowering effects, This one must be taken under medical supervision, especially in people already on cholesterol or diabetes medications. Herb number 20. Silymarin milk thistle, Silybum marianum. Silymarin, from milk thistle seed, has long been used in liver disorders. Recent research suggests it may reduce insulin resistance, significantly decrease fasting insulin levels, and lower liver enzyme levels, in some cases showing better results than metformin in small trials. Herb number 21. Sulforaphane, from cruciferous vegetables. Sulforaphane is a phytochemical found in broccoli, kale, cabbage and other cruciferous vegetables. Not only has it shown strong cancer preventive actions, but it's also shown a reduction in blood sugars by around 10% in some early studies. Herb number 22. Okra. Okra is an edible seed pod that comes in green and red varieties. People typically think of okra as a vegetable, though it's technically a fruit. Okra is part of the mallow family of botanicals, which also includes cocoa and cotton. It's good for cholesterol, blood sugar, your gut and, surprise, stronger bones. It's time to start eating okra. Okra contains beneficial antioxidants, fiber, vitamins and minerals. Its disease-fighting nutrients promote heart health, blood sugar management and better digestion. Okra also boosts bone health due to its calcium and vitamin K content. Before using any of these herbs or plant extracts, here are some crucial safety points. Herbs may add to the effect of your medication, so if you're on insulin, metformin or sulfonylureas, the risk of hypoglycemia, low blood sugar, increases. Caution: berberine may interact with diabetes medications. Lifestyle changes remains foundational. Diet, exercise, weight control, manage stress level, and sound sleep. Herbs are supportive, not magic bullets. Always consult your endocrinologist, primary doctor or pharmacist, especially if you have kidney, liver issues, are pregnant, or are using multiple medications. To recap, there's a growing body of research supporting medicinal plants and herbs for type 2 diabetes, from berberine to cinnamon to okra. While the evidence varies in strength, and no herb replaces conventional therapy or lifestyle changes, they can offer an additional tool in your wellness toolbox. If you found this video helpful, please hit like, subscribe, and click the bell icon so you don't miss our upcoming deep dives into herbs for diabetic neuropathy and vascular health. Drop a comment below. Which herb would you like us to explore next, or share your experience, always with your doctor's guidance. Thanks for watching. Stay informed, stay empowered, and stay well. Health is wealth. This information is for educational purposes only, not medical advice. Stay safe and I'll see you in the next video.